Hello, my name is Janet Calderero. I'm a doctorate student. I am studying clinical psychology at California Southern University. So today I will discuss panic disorder through the lens of emotional and motivational development. I will examine the physiological underpinnings, including what happens in the brain, discuss key neurotransmitters and hormones, delve into the causes of and comorbidities, and review evidence-based treatment and essential support systems for recovery. So, what is a panic disorder? So, I've had a professor explain it this way to me. So, if you imagine the brain is like a car, you have the amygdala, which is where the fear is housed and all the anxiety, and you have the prefrontal cortex of the brain, and that is like where all your reasoning is. And so when someone is suffering from a panic disorder, the amygdala is malfunctioning. So also, the prefrontal cortex is also malfunctioning. So it's like a car. So it's like the amygdala is like the gas, and the prefrontal cortex is like the brakes. So it's like being in a car where the brakes are malfunctioning. So when you have a panic disorder, it is a debilitating mental condition, and it's characterized by sudden, repeated panic attacks that often occur without an apparent trigger. These episodes can be both emotionally distressing, and physically overwhelming. So I imagine I never have been in a car where the brakes are going out, but that would be very overwhelming and emotionally distressing. And so when a person has a panic disorder, it severely impacts the individual's quality of life. So here is an MRI scan of the brain during a panic attack. So a panic disorder is rooted in severe biological processes. Sometimes panic disorder and panic attack, they're used interchangeably, but when I say panic attack, I really mean panic disorder. So, as I mentioned earlier, the amygdala, often referred to as the brain fear center, it's hyperactive. It triggers exaggerated fear responses to perceived threats. Additionally, the hyperactivity-adrenal, also referred to as HPA, this axis becomes dysregulated. So this results in excessive release of cortisol, which is the stress hormone, which can intensify anxiety symptoms over time. So functional MRI studies demonstrate increased activity in fear processing areas, so the amygdala. Also, this includes the hippocampus, where all the memory is housed. That's the part of the brain, and the periaqueductal debris during panic episodes. So, as a result, the sympathetic nervous system activates the flight or fight response, rapidly increasing heart rate, blood pressure, and respiration. In contrast, the parasympathetic nervous system, which should restore balance, is often delayed or under-responsive in those with panic disorder, leading to a prolonged physical symptoms. Several neurochemical imbalance contribute to panic disorder. Norepinephrine surges during panic, heightened physical alertness and arousal. Serotonin, critical for emotional regulation, is often found in reduced levels in panic disorder. The gamma butyric acid, an inhibitor, I'm sorry, an inhibitory neurotransmitter, is typically deficient. diminishing the brain's ability to calm excessive neural activity. So we all heard of the fight, flight, or freeze response. So this is just a way of our brain and our body being connected. And so whenever there's a perceived or real danger, our body has this natural mechanism to protect itself. So it's been changed to fight, flight, or freeze. So I guess whenever we are in fear of something, our bodies want to either fight, flight, or freeze. So the fight, flight, or freeze response is an evolutionary survival mechanism. However, in the case of a panic disorder, this response is misfired, often in non-threatening environments, such as while shopping or driving. Symptoms include chest pain, shortness of breath, trembling, dizziness, and a sense of impending doom, all occurring in the absence of actual danger. So, the causes of panic disorder is multifactual. Some people are genetically predispositioned for panic disorder. Genetic predisposition accounts for approximately 40% of the risk. Environmental stressors, such as early life trauma, abuse, or significant life transitions, play a critical role. Cognitive behavioral theories propose that individuals with panic disorder catastrophically misinterpret benign bodily sensations, leading to a self-reinforcing panic cycle. Panic disorder rarely occurs in isolation and is frequently comorbid with other psychiatric conditions. So, including generalized anxiety disorder. So, when you have generalized anxiety disorder, it's persistent and excessive worry. Major depressive disorder. So, this is an overlapping mood dysregulation. Substance use disorder. So, some individuals may choose to self medicate to relieve symptoms. Agoraphobia is a fear of situations where escape might be difficult. So, as far as medications, there are some pharmacological treatment, which is often used in conjunction with therapy. So, things like, well, medications like selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, this is SNRIs, are the first line of treatment for panic disorder. So benzodiazepine may also be prescribed for short-term relief, but carry the risk of tolerance and dependence. Beta blockers, while not address the root cause, may reduce physical symptoms such as rapid heartbeat. So in therapy, there are some techniques. So in session, this could be cognitive restructuring to challenge those irrational thoughts, diaphragmatic breathing and progressive muscle relaxation to calm the nervous system, behavioral experiments that help disprove fear-based beliefs through real-world exposure. So in addition to medication and therapeutic techniques, there is also support systems. So having a support network is crucial in long-term recovery. So having family and peer support enhance emotional resilience. Access to therapy and mental health care provides consistent treatment. Crisis hotlines offer immediate assistance during acute episodes. And workplace accommodations such as quiet spaces or a flexible schedule may help reduce triggers. So, final thoughts on panic disorders. So, a panic disorder is a multifaceted condition involving complex interaction between brain chemistry, emotional regulation, and cognitive patterns. With the right combination of therapy, medication, and support, people can regain control and lead meaningful, fulfilling lives. Continued research and increased public education are essential for reducing stigma and improving access to care. So these are the references I used to get the information for this presentation. I appreciate you joining me today and learning about panic disorders.